Glenda Maclean. I'm a family doctor. I've been in practice in Calgary for 19 years now. I initially started out as a family practitioner and did family medicine obstetrics. So I have a fairly young practice as a result. Now I just do full service family medicine at Southport Family Practice in the southwest of Calgary. A colleague of mine invited Dr. Livingston and Alethea into the office to do a little bit of a demonstration in 20. And at that point in time, we were using Alethea to take photos, using the otoscope to take photos of eardrums, if we had questions about patients, using photos to send to dermatology to get quick access to specialist care. This was in the middle of the pandemic, so this was a handy way to get some advice quickly for patients that were struggling maybe with being seen face-to-face in specialty offices. So that was sort of my first sort of jump into using the portal. I also was working in a seniors facility at that point in time, and so I found it was a really handy tool for getting opinions on patients who would struggle otherwise to get out to offices. Definitely that, so providing care for patients who would struggle to get out of their home or out to a specialty office. So certainly my seniors sometimes will have mobility issues where getting to a specialty office is difficult. They'll come to me with things like, can't you just handle this here, Dr. Maclean? I don't want to see a cardiologist or go to a dermatologist. So for patients like that, this program was ideal. Also helpful for patients where I just had a little question. Maybe they don't need a full assessment with a specialist for their concern, but we just wanted to check in. Are we doing the right thing? Do you have any other suggestions? It's been a helpful program for that. I would say so. I think patients always like the security of if there's a more complicated health issue that we're working through, that we sort of have had the opinion of an expert on their care. I think the other thing that I've found it really helpful for is when wait times are long for patients to see a specialist, to be able to consult someone and say, well, how can I further the workup of this problem for this patient while they wait to see a specialist? When they do finally get to their specialty consultation, they're not immediately then being sent out for more tests. Sometimes the specialist is able to give them some more comprehensive assessment because we've been able to do more of the investigations that were needed in the meantime while they waited to be seen. I think it's excellent. Some of my favorite specialists that I would be consulting with or sending my patients off to see are on the app, so I quite trust the opinions and enjoy the opinions of the specialists that are there. It's far faster than a traditional referral in that I will get an answer sometimes same day or within a couple of days when asking for an opinion on my patients. I also would say that I like the Alethea consultations better than something like Specialist Link, because I can type up the consultation and then receive the advice on my time. Sometimes when we're doing things like doing a phone consultation with a specialist on call, they're busy, I'm busy. Touching base with them can be disruptive to my clinic and theirs. In this way, I can make the referral and then read the referral and then contact the patient back, all in timeframes that are sort of more convenient, more realistic for me, and potentially, I guess, for the specialist as well, and sometimes for the patient too. I think my favorite feature is just how quickly you get the information back. Lately, I would say the other thing that I've enjoyed is that sometimes if I put a referral into a specialist and the specialist doesn't have all of the answers, sometimes they consult a second specialist inside of the Alethea app. You get almost like a round table effect of, I've asked a question to a cardiologist, but then the cardiologist has then bounced the referral over to the nephrologist saying, I'm not quite sure, well, let's see what this person thinks. So you get even sort of a broader bit of information for the patient. And you can imagine in real time, if I had sent that referral to a cardiologist and the cardiologist says, I think I also need to get a nephrology opinion, it would be months before the patient had seen all these people. And with the program, sometimes you're getting the opinions of multiple specialists within days, which is almost kind of unheard of. There's nowhere else where I would get that.